Now, as you may know, former US President Joe Biden has been diagnosed with an aggressive form of cancer which has spread to the bone. Doctors not involved in Mr. Biden's care say his diagnosis shows the nuance and challenges of screening for prostate cancer. They say it is possible his tumor may have been missed or gone undetected by routine testing. So how dangerous is prostate cancer? Well, black men are more likely than white men to get it and are twice as likely to die from the disease. And here in Nigeria, it is the most prevalent and deadliest cancer for men, with a high incidence and mortality rate, according to a report published in the Lancet Oncology. Well, for more on this, I'm joined now in the studio by a senior oncologist at the National Hospital here in Abuja, Dr. Chinedu Aruah. Thank you very much indeed for coming in.
Thank you, Mr. Nagolo, for giving me an opportunity to be here.
Sure. What's your reaction to the news about former President Biden having an aggressive form of prostate cancer at his age of 82?
It was not unexpected because, as we know, as clinicians, prostate is a age-related disease, and most often at his level, at his age, he's supposed to have been undergoing screening tests, knowing full well that this is one of the diseases that occur with age, with advancing age. So he's supposed to have benefited from screening tests and proper follow-up. So,
right. It's interesting you say that, because obviously he is president, former president, and this prostate was caught after it had already spread and had become metastatic. What does that mean in terms of the risks that he faces? Is that the highest grade, the fact that it's metastasized?
Yes, actually, when we have a metastatic disease, we normally grade or stage prostate cancer. We have stage 1, 2, 3. The higher the stage, the more the risk. So at stage 4 is a very high risk state, and it's quite unfortunate that they could not detect it as early as possible. And somehow his handlers may have missed it, especially those who are in charge of his routine health check. They must have missed it. But most often, because prostate cancer sometimes is slow growing and remain a little bit undetected in some cases, especially in Caucasians, it occurs in advanced age, unlike the black occurred earlier in the age group. So I think at that point they must have overlooked that, and they just thought that all is going well. So,
well, you don't sort of think of the president of the United States or somebody who was president. I mean, you think that he'd get the very best health care, because even in Britain, I mean, once you get over 50, I think, they start phoning you regularly. Every 6 months you must go for a test, a prostate cancer test and all the rest of it. I can't imagine how they didn't detect his PSIs were high or something.
Well, most often when a patient have other comorbidities, that may be down in their list of concern.
Right.
So they may be thinking of other things. If you have other comorbidities, like he has a bit of senile dementia, which we know sometimes he forgets a lot of things.
Right.
And so their neurologists and the rest of them may be more concerned about that clinical condition and overlook the prostate. So it do happen in medical medicine.
And his doctors say that in spite of all that, they can manage it. Yes. Those were the terms they use. What does this mean? Can he handle the treatment at that age, 82?
Yes, when we talk about management, they are now already shifting curability. They are no longer talking about curability at that point, because when we talk about curability, we are looking at those early stages. But now it's already stage 4, which is an advanced stage, and have already spread to the bones, and which is where the prostate have pre-deletion in terms of spreading. In most cases, when it's spread, it's always on the bone. Then later it can go to visceral organs. But now, what they're talking about, that they can give him quality of life.
So is it sort of palliative care?
Palliative, yes, that's support.
Right,
quality,
okay.
yes, palliative treatment, that's
Terrible.
Improving the quality of his life, but they cannot guarantee cure.
But they can keep him alive.
Yes, you can keep him alive for some time.
Right.
But they cannot guarantee cure. At this point in time, they will have to discuss extensively with the patient and tell him the extent of the disease by doing further evaluation and now coming up with a treatment protocol that is suitable for his age.
But for the general public, I mean, I understand that prostate cancer diagnosis is usually as close to benign as you can get with a cancer.
The prostate enlargement, prostate can enlarge, especially with advancing age, but not all enlargement of prostate is cancerous. So we have to distinguish it between the benign aspect and the cancerous aspect. So when a patient goes to the hospital, it's some of these screening tests that we try as much as possible to do, and that we're now going to put them on the two sides. And the benign cases, there are no cause of worry. All you need to do is the surgeons to intervene appropriately. And that of the cancerous type, now we have a long way to go in terms of,
I was going to ask you that. I mean, what are the treatment options, and can they potentially cure you from the cancer?
Yes, at early stage. At early stage, in short, prostate cancer is now becoming one of the, at least let me say, common curable cancers, especially at early stage, because of the treatment option that's available. We have the radiotherapy aspect, we have the surgery aspect, we have the robotic surgery. In short, we have advanced surgery that's robot can intervene and do the surgery. We have laser. We have so many processes of handling it, but it becomes a big challenge once it starts metastasizing. Once it moves and starts spreading to other parts of the body, it becomes a bigger challenge.
And what is the option at that point in terms of treatment?
That option, we look at, first of all, we have to do a wide range of tests to localize where the cancer has spread to. Has it spread to the spine? Mostly it goes to the spine or the pelvic bone. Then, because if it gets to the spine, it may cause weakness of the leg, and at some point it causes what we call cord compression, whereby the patient will not be able to walk. So, which is one of the primary concerns of the patient. Then sometimes it affects the way they can control their urine or going to toilet. So they may have incontinence, or they may have constipation. So these are varied. So we have to evaluate the patient completely and come up with the treatment modality. We either, if the patient is having bone pain, we have to go for radiotherapy to alleviate the pain with analgesics. Then if the patient not having bone pain, we can equally go for chemotherapy. Now we equally have immunotherapy to go along. Then we equally have radio pharmaceuticals that we can use that to ablate the bone affectations.
Extraordinary. I understand that globally around 1.3 million men are diagnosed with prostate cancer. That sounds like it's very common cancer, actually.
Yes, actually, it's one of the most common cancer that affect men. Now, from the recent research and recent publication from the Globalcom, they now classified as the fourth most common.
Right.
Because this lung, colorectal, and this liver cancers have taken over, then followed by prostate.
And how many of those are diagnosed in Nigeria, prostate?
That of Nigeria case is a peculiar case because some of the information I get is hospital-based, so we don't have national cancer registry, a functional national cancer registry. So some of the patients that died of prostate cancer or diagnosed of prostate cancer are missed, especially in the rural area. So whatever we get is just an estimate coming from various hospitals. So so it's most often those data are not reliable. So, but we can just make an estimate.
But from your own point of view, I mean, you're an oncologist. You work at the National Hospital in Abuja. Do you see a lot of people?
Yes.
With,
if I have 10 patients who are above 50 years. Presenting in the hospital, at least 5 of them will be prostate cancer.
Right.
That's how frequent it is.
So it is quite prevalent.
Yes, but I mentioned the age.
But many of them...
I mentioned the age.
Yes, you did. And are many of them at an advanced stage when they come to see you?
Yes, most often they are presented at stage 3 disease. That's the most common, stage 3 disease, which is advanced. Then it's only few that we pick at stage 1, which is called incidental finding.
Right.
Maybe a patient came for a different thing altogether. We say, okay, Papa, you are 60 years old. Have you ever done prostate PSA? That's prostate-specific antigen test. You say, no. I was okay, Papa.
And the reason why it's caught at that later stage is that most of them never get around to it, because it doesn't actually, you don't get any symptoms.
Yes, majority is asymptomatic.
Yeah.
It gives symptoms when the disease is now start advancing. Maybe it gives something that will look like a lower urinary tract infection. A symptom that look like that, maybe frequency in urination, then not having urgency, not completely emptying the bladder, then waist pain. Then with advanced stage, we now start seeing blood in the urine. Then we start, patient may start now having bone pain that may be generalized. So, and if not taken care, then we have that what we call compression because of its predeletion to the spine.
So just returning to former US President Joe Biden and his diagnosis of an aggressive form of sort of prostate cancer. I mean, it strikes one that, I suppose this is not really relevant to you. I mean, if he had been re-elected, they would have had a big problem in terms of governance, wouldn't they? But, I mean, just tell us how would you describe prostate cancer? How does it attack the body? You see what I mean? Is there any way that you can describe it in terms that ordinary people like me can understand?
Okay, yes. Is an organ that always that's found specifically in men. You don't see prostate in a woman. You only see prostate in a higher mammal like chimpanzee. You see that, and the aim is to add fluid to the seminal, to the semen. So during ejaculation, it helps in lubrication of the semen. So and it is found within the pelvis, almost close to the neck of the bladder, and surrounding the urethra. So usually at a younger age, no problem, freely doing its function. But as patients start advancing, then it starts enlarging. Advancing in age, it starts enlarging, and this enlargement can be on the cancerous part, or it can be in a benign form. So, but the gold standard is that we have now found a way of making sure that it's now detected early by doing screening tests.
Right, and you have that equipment in Nigeria?
Yes, the screening is simple. Screening test, you do your PSA.
I mean, they do a blood test now, don't they?
Yes, you do your PSA, you do digital rectal examination. The digital rectal examination that you now put hand through the anus to feel the prostate. You are looking at the...
but that's when it's advanced. I mean, because in most cases abroad now, they just give you a blood test to know.
They can do blood test.
Right.
Yes, but we are now talking about our environment where the resources are limited.
Right.
Yeah, so you must teach. One of the things we teach our students, because you may go to some of these teaching hospitals, you may not access those sophisticated equipment.
Right.
We have a magnetic resonance imaging, paramagnet, that you can use it to detect prostate cancer without talking about digital rectal examination. But digital rectal examination combined with PSA gives you excellent diagnosis until proven otherwise.
Well, I want to thank you very much indeed, Doctor. You've enlightened us quite a bit and also scared us quite a bit.
No.
If you're out there, go and get your prostate cancer test, because you never quite know when it's going to hit, do you?
Okay, thank you.
Doc, thank you very much indeed. Dr. Chinedu Aruah is a senior oncologist at the National Hospital here in Abuja. Thank you very much indeed.
Thank you, Chief Anambra.